In this second video, we will focus on the 9 National Health and Wellbeing Outcomes and the expectation on your IJB to deliver these. We describe the delegation of services to an IJB and the reasons for variation across Scotland.
For the first time with this legislation, there is set out what is expected to be achieved as a consequence of formal health and social care provision being made available to people. It does so by setting down 9 national health and wellbeing outcomes. Prior to this Act, health and social care legislation almost entirely set out what inputs and outputs are expected of health boards or councils. For example, treatment time guarantees or the provision of residential care for people assessed as requiring that level of support. Implicit in these, of course, is an expectation of quality, and certainly quality is reinforced by other tools such as clinical standards, patient safety treatment programs, national care standards, all of which are inspected upon by external regulatory bodies and is important, merit-worthy and not to be avoided. However, in setting down the 9 national health and wellbeing outcomes in the legislation, this Act compels integration authorities through yourselves as decision makers to have a qualitatively different impact on citizens. You are charged to ensure that in your IJB area, 1. People are able to look after and improve their own health and well-being and live in good health for longer. 2. People, including those with disabilities or long-term conditions or who are frail, are able to live as far as reasonably practicable, independently and at home or in a homely setting in their community. 3. People who use health and social care services have positive experiences of those services and have their dignity respected. 4. Health and social care services are centred on helping to maintain or improve the quality of life of people who use those services. 5. Health and social care services contribute to reducing health inequalities. 6. People who provide unpaid care are supported to look after their own health and well-being, including to reduce any negative impact of their caring role on their own health and well-being. 7. People who use health and social care services are safe from harm. 8. People who work in health and social care services feel engaged with the work they do and are supported to continuously improve the information, support, care and treatment they provide. 9. Resources are used effectively and efficiently in the provision. It is acknowledged that in general terms the National Performance Framework clearly sets out the aspirations for what kind of Scotland we want to live in, and many of these aspirations touch on and have a synergy with the 9 national health and wellbeing outcomes. That necessarily takes you and your fellow IJB members, voting and non-voting, to a whole different level of thinking and being from whatever your previous and continuing experience is within your health board or council. The regulations that underpin the Public Bodies Act set out which health and social care functions and services must be delegated, which, as a minimum, must include all of adult social care, adult primary and community health care, and a proportion of adult acute hospital services. Other services, including children's health and social care and criminal justice, may also be included in integrated arrangements if there is local agreement between the Health Board and the Council. And variation is in place across Scotland, adding to the complexity mentioned earlier. In some areas, such as Glasgow, the Council has decided to put in all children's and criminal justice social work, homelessness and alcohol and drug services. In Glasgow, this has created an integrated planning environment for the IJB of over £1 billion in annual expenditure and a combined Health Board and Council social care workforce working under the authority of the Chief Officer of over 12,000 employees. Other health boards and councils have gone for a minimum position involving only adult health and social care provision and have retained control over the rest. It is vitally important that fair and equitable consideration is regularly given by all IJBs to the totality of all areas of their delegated business in relation to health and social care. Doing so will ensure that there is a better chance that the national outcomes will be achieved for all of a council area's citizens and not just some. It also reinforces the fact that the integration of health and social care is about so much more than focusing on reducing delayed discharges in hospitals and easing the pressures on the local hospital system. These issues absolutely need to be addressed and given due attention. But giving too much attention to these types of system pressures may in too many instances lead to other issues that are important to citizens becoming or remaining hidden when action is as much required elsewhere. As earlier, you might want to spend some time after this video in quiet self-reflection about how well or otherwise you think your IJB has performed in this respect. If your IJB has delegated responsibility, for example, for prison healthcare, or children's residential and fostering services, or criminal justice social work services, or public protection services, or all of these, are you comfortable with the level of information, plans and proposals with which to achieve the 9 national health and wellbeing outcomes for the citizens engaged in those services being presented to and considered by your IJB?